Right, well my name is Gillian Baird. I'm a paediatrician at Guy's and St Thomas's, which is a NHS resource. It's a foundation trust, and I also am Professor of Paediatric Neurodisability at King's College London.
So the NICE guidelines set out clear recommendations on how to develop an effective diagnostic pathway for children. Obviously, we have the draft guidelines for adults. What do you feel are the key challenges for professionals to actually implement or to develop in their locality an effective diagnostic pathway?
Well, I think many of them already done so, and I think the will to do so is there for most of them. I think the real difficulties are going to be about protecting in your individual resources in a time of economic stress, because what we're proposing is that there should be far greater integration, which really means bringing in some educational resource into the health service and vice versa. So it's working together in an integrated fashion. And when there's rather more money, that's much easier to do. When there's less money, people can become rather more protective, but I think that's very important. Many health service resources have no psychology input, do not have clinical psychologists working with them, and I think it's a very important section of what we were recommending, so I hope that that's the direction that people will try to move to. And then, of course, the visits to schools, which I was outlining in the talk, that I think there's no point in doing very extensive assessments if you don't then translate that into where the children are and the support for their families. So that's a jumping off point for, again, integration.
On a day-to-day level, in terms of making diagnoses, what do you hear from diagnosticians and clinicians as the key barriers, say, in terms of diagnosing girls with potential autism?
I think girls is one example, but I think the challenge for many of us is the recognition that there are a large number of people who have traits of autism, and it's making a decision about whether or not that constitutes a sufficient difficulty to have a diagnosis. So it's always in the grey area that everybody has diagnostic challenges. And that's really what I was referring to when I said that it used to be quite easy categorical diagnosis, but now with the idea of dimensions, it's quite difficult to know where the cut-off is, and that may vary with age, and that's always difficult when people feel that resource is tied to a definite diagnosis, so there's a great pressure to diagnose. But we know it's a developmental pattern with an underlying cognitive style, and that some features may be very prominent, let's say at the age of 2, but by the age of 4, 5 or 6 they may be much less obvious, and there may not be significant later impairment, but there may, and that's a real challenge.
And lastly, what are your thoughts on the future changes to DSM-5 and ICD-11?
Well, I've been involved with both of them and sit on both committees. I think that it makes sense to me that the domains are reduced by to 2, that social and communication difficulties. There are, of course, additional language concerns, but they're outside the core features because we know many young people do not have early language difficulties. And we know that the subgroup diagnoses are used highly variably. And so having it all in one large category is, I think, where the knowledge is at the present time, however unsatisfactory it is. There is a concern, and I don't know how realistic it is because the work hasn't been done, that perhaps those who are very high functioning, have very good language, very highly intelligent, may not have a diagnosis under the proposed DSM criteria. I do not think we yet know whether that's the case or not.
Thank you.